All right, great. All right, great. Let's keep having the names rolling in. Joy is connecting from Nsukka, Enugu State. Right from Enugu State. You're welcome. You are welcome. You're welcome. We're glad to have you here. Oluwapelumi Emmanuel joining us from Lagos State. We are so glad to have you here. You're welcome. You're welcome. And I am Adewumi Oluwatobiloba Theophilus, and I will be the moderator for today's event, for today's session. And I am not here alone. I'm not here alone. Ibidun Farida, who is also a registered nurse, will be co-moderating with me. Farida, are you in the house? Can you just say hello to our
Yeah, I'm in the
tonight?
house.
All right, Farida, can you just
Hello,
say hello
everybody.
to our audience tonight? Yeah, welcome, Farida.
Yeah,
And
I'll be happy to join you.
Yeah, once again, I'm so excited to see everyone, here ready and eager to gain deeper understanding and broaden your horizon of knowledge on the concept which appears to be the talk of the decade in healthcare, which is digital health. You will agree or you will disagree with me that, before COVID-19, some industries have been making use of technology. They've been leveraging the advantages and the benefits that, the digital space and the digital world has to offer. But it is quite unfortunate that we had to wait for COVID-19 to come before we realized that the healthcare industry is not yet fully maximizing, or we are not leveraging the importance of technology enough. And as such, after COVID-19, digital health, we've been able to, COVID-19 made us see some gaps, some inconsistencies in healthcare delivery, in the healthcare industry that technology can solve, the gaps that technology can bridge. And the post-COVID era has made us to understand that technology can actually come into space and bridge these gaps. And this has made the word digital health, e-health, telehealth, health tech, this category of words, it has made it quite popular in the past 2 years post-COVID. And it is not only interesting to know that, okay, digital health and technology is taking over the healthcare industry. We as healthcare professionals, we have our roles to play. We have the things to do. We have spheres in technology where we have to function. Some of us need to gain, deeper understanding on what digital health actually entails. We need to learn how to position ourselves to maximize the benefit and the potentials that technology has brought into the healthcare industry. And I'm happy and excited to announce to you that in this conference, all these things I've listed will be made available to everyone. You get to know how to position yourself for the benefit that the technology has brought. You get to know how you can leverage technology in healthcare for efficiency in your practice and as well for your personal and professional development. And a lot of other things are available in this conference for you to learn. And we already have our seasoned and experts speakers in the field of healthcare technology and digital health on ground, to dish us with a lot of stuff that will, transform our mind and, help us to better position to maximize the effect, the benefits of digital health. So right now, I would like to welcome us once again, and I would like to bring up the CEO and the founder of Carecode Digital Health Hub, to give us his welcome address. The founder of Carecode Digital Health Hub to give us his welcome address. Nurse Ayinla Daniel, you are welcome, sir. We are glad to have you in our midst tonight. Good evening, sir. Can you hear me?
All right, thank you so much. Without wasting time, I already wrote a more formal speech in the brochure, but I'll just make this a bit informal. I want to first of all thank my team members, and Toby, who is anchoring the program. He's our co-founder and our COO. Been a very good job, been a very good support, very, very smart and intelligent, and professional. I also want to thank volunteers. But for startups in especially in Africa, we depend largely on volunteers and partners, because at first we don't really have the resources to employ and hire full-time workers. So we work with volunteers, we work with freelancers, work with partners and sponsors. So I want to thank all our volunteers and our friends who have made this conference possible. I can tell you that without them, we will not have what we are seeing today. I also want to thank our friends. I call them friends because they support our vision. They understand what Carecode is doing. I've been able to key into the vision and the mission. I want to thank them from the depth of my heart. I also want to thank our sponsors and our partners. They have made this dream possible. They have made this conference possible. And lastly, I want to thank all participants who have taken time out of their busy schedules, especially as healthcare professionals. We are extremely busy people: doctors, the nurses, the pharmacists, the medical scientists, the engineers, the lab scientists, and others. They are very busy people. And putting the conference on a Friday, we hope that we get some participants listen to what we have to say, to what our speakers have to say about digital health in Africa and health tech as a whole. Once more, I welcome us all to this conference, and I promise you that we're going to leave here inspired. We're going to leave here informed. We're going to leave here equipped with knowledge and information on what to do and how to lead the future of healthcare in Africa. Thank you so much.
Thank you, Nos Ayinla Daniel, the CEO of and the founder of Carecode Digital Health Hub. Thank you so much for that welcome speech. All right, so right about now, we'll be moving on straight into the keynote address of this event. We'll be moving on to the keynote address of this event. And to give the keynote speech is Dr. Akambi Raphael. And before he goes into his speech, we'd like to read his citation. Faridat, are you ready?
Yes, I'm ready.
All right, please kindly read the citation of Dr. Akambi Raphael.
Yes, I'm ready, please. Can I go on?
Yes, please. Yes, please.
Okay. So good evening once again, everybody. My name is Faridat Ibidun. I'm a registered nurse, a tech enthusiast, and I'm a web developer. And privileged to be with everybody on this beautiful space, exploring the opportunities in health and technology. Wow, that's a very beautiful future. So I'll be introducing one of our guest speakers, Dr. Raphael Akambi. So Dr. Raphael Akambi is an accomplished digital health and health informatics, EMR/EHR consultant, and lecturer with over 18 years of experience, both in healthcare system and higher institution of learning, locally and internationally.
Ibido, it's my pleasure to be here. And sincerely speaking, when you were reading the profile, I was asking myself, I said, wow, you mean you've gone this far? I want to really appreciate the platform you guys have given out to me for, to be in the midst of these great people, to discuss something that I'm very, very much passionate, about. That is talking about digital health. Before I start, while the administrator is trying to still put, the permission for me to share the screen, in place, I want to really, commend the efforts of the Carecodes, I mean, the organizers of this, great event, because if we can be having this, many times, in this country, particularly from the youth, who have put this in together, I think we're going to really go, to places in this country. And of course, the purpose, of organizing this very audacious, event is really going to have great impact in the life of the participants as a whole. And believe me, I know that this event is going to really go far and wide, because when I was thought I was going to speak around here, I practically discussed, inform my colleagues both within the country and outside the country, and a lot of them are very much eager to join, and which I believe very soon they may be part of us in this place. So I want to really appreciate you once again, and I wouldn't want to waste much of our time, because time is money. We need to really quickly go into the meat of the matter. Yeah, once again, I want to really appreciate the organizers who bring me up here to discuss this. And sincerely speaking, even at the Ministry of Health, where I work, in fact, I never even knew that some people on social media have seen something like this and they were just telling me up and down that, oh, we're going to be part of this, we're going to be part of this. Which is a very good thing, and I want to encourage you guys to keep it up. I'm aware that most of the people I'll be talking to today are both medical and paramedical practitioners, students, and so on and so forth. So, and I just want us to really have this understanding here that digital health is not something that is just coming up in the country. It has been existing in Nigeria, and though not for so long, but very, very, it's something that has been going on in the country since the year 2000. But before we go further, I want us to just let us take it one after the other for us to be able to have the understanding of what we, will be talking about here. Now we have the table of contents here. So, though not in its totality. So part of the thing we're going to talk about here, we look at the evolution of digital health, Nigerian journey of digital health challenges in developing countries, unlocking digital healthcare in the developing country, importance of digital health tools in healthcare among developing countries as well. So we quickly move into the evolution of digital health. It is very, very important for every one of us to have the understanding of how digital health was given birth to. And this is one of the very important things that, instead of, climbing the tree, from the top, we need to start from the base of the tree in order for us to have the experience of how digital health, is moving gradually into the latest information that we have presently in our country. Now, we know that talking about the evolution of digital health, we're looking at the history of digital health, not in Nigeria this time around, but we're looking at how it started around the globe. And I'm going to start by saying that during the past couple of decades, it has become very clear that when referring to the future of almost all disciplines in the world today, there is one thing that comes into mind, and that thing is technology. And the breathtaking pace at which artificial intelligence and information technology, are changing the world is undeniable. Everybody can see it. We can see that, technology has really gotten into, every fiber of every individual in the globe today. And I believe strongly that, the participant here, that are listening to me, I believe every one of us have that very full understanding of what technology is all about. it is very, very important. And one field where we see this place, this space, that is working effectively is in the field of medicine. And the intersection of new technologies and healthcare is referred to as what? Digital health. And digital health, is a simple concept, which simply means using technological methods and processes to improve people's well-being. I'm so glad today that I have very beautiful, wonderful, healthcare, potential healthcare givers, in the house today. And, it is my advice that, every one of us, irrespective of the area of your focus in healthcare industry, it is very important that digital health is one of the vital instruments that every one of us needs to really embrace today. And by the time you embrace it, you discover that everything about your practice is going to take a new turn. So, like I said earlier on, the simple concept that has to do with digital health is what is the technological method and process which is fused together with the practice of healthcare in order to improve people's well-being. That is what is called digital health, while also empowering patients to make better informed decisions about their health. Yet we need to look at this that what makes digital health so fascinating is the complexity that results from this relatively simple definition. That is talking about from wearable devices to telemedicine, and digital health is really, really revolutionizing the field of healthcare today. Gone are those days where you will, say you want to, travel several miles before you get into the hospital to get, the appropriate care that is required. This time around, you can be in your house and your consultant or your physician can consult you, and even your nurses can even attend to you digitally, except in a very rare case whereby, you will need to visit the hospital for a physical consultation and other, diagnosis methods. Now, let us begin by discussing the origin of digital health. I want to quote a very beautiful lady that is known as Maya Angelou. Maya Angelou says something. He said, if you don't know where you are coming from, you don't know where you are going. I'm very sure it is not a very new, saying that if you don't know where you're coming from, so it is very sure that you don't know where you are going. In other words, studying the history of digital health will enable us to further understand the roots and conclude where it is taking us to. In order to review the history we are talking about, we must go back to the end of the 19th century, and the beginning is with the subfield of digital health that is now becoming more important than ever, which is also known as what? Telemedicine. We have so many, under it, but we just have to start from somewhere. Now we quickly look at the beginning era, which is between the year 1897, no, it is 1897 rather, and this is when digital health was given birth to. Some of us will ask, wow, is it this long? Why are we just hearing it in Nigeria, recently? We need to know that Nigeria is part of the developing countries that we're talking about, and we're just moving gradually. Although, as a digital health consultant, I am not really fascinated with the speed at which, the digital health is moving in this country. So let's look at the history right from the beginning, which is 1897. And as one of the most comprehensive area of digital health, telemedicine encompasses using electronic form of communication. For example, we have phone and we have video calls. That was how it started from, in order to perform medical diagnosis. And I'm going to quote another person here. That is, two theorists here. That is talking about Adam Dakin and Margaret Carey. in their book, which is titled Telemedicine and Telehealth, Principles, Policies, Performance, and Pitfall, which came up in 1897. That, I mean, of course, that was the first documented telemedicine that has ever happened. And during this time, a child was diagnosed with croup. A croup is an infectious disease, which affects the airways, and it is characterized by a distinctive cough. That was the first case that was first attended to, during the year we're talking about in 1897. And this was the time, the telephone consultation with physician started, and despite its early appearance until nearly 9 decades, ago, after this incident, long-distance diagnosis was reserved for countries like Antarctica expedition and later for space missions. It started moving gradually, like that. Now, secondly, we look into the growth era, which is between 1950 to 1999. I'm going to be very fast about it because of the time, given to me. Now, this is the time, we started experiencing the growth of digital health gradually. And during the second half of the 20th century, the development of ultrasound imaging techniques, artificial organs, and DNA sequences which clarify the degree to which technology can be used in medicine. This we can say this was when this technology started emerging. This invention paved way, for digital health to go further than telemedicine and beyond the boundary of diagnosis in order to provide adequate and effective treatment in the world. So the end of the 80s into the 90s were golden time for digital health in the world. So during this time, there are a lot of several associations that appeared, in the United States of America and around the world in order to improve the healthcare delivery through digital communication. And some of these, organizations, some of these associations are the International Medical Informatics Association, the American Telemedicine Association, and the European Health Telematics Association. And this organization greatly impacted the transition from traditional healthcare methods to more advanced technology-driven substitutes. So this is one of the, developments we're having, and this grows gradually into the era of maturation. That is talking about between year 2000 and year 2015. And during this period, we observe an increasing desire to digitize healthcare. Of course, the news have started spreading. People started getting to understand what digital health is and the importance of digital health. And since the beginning of the 21st century technological innovation, like the World Wide Web, which became more user-friendly, and the patient gained easier access to the world of medicine. Of course, you can now say that during that time, people can actually go to the World Wide Web to really search for different information as related to their health. So they moved into it, and at the same time, new terms in the realm of digital health began to appear, such as mobile health, electronic health, and also personalized electronic health. So this started growing gradually, and there are so many other associations and organizations that feed into this development.
Wow.
Over to you.
Wow. Wow. Thank you so much, Dr. Akongbe. Wow, this presentation is just a mind-blowing one. We had a lot of statistics. We had a lot of information to give us insight into what digital health is, how it started right from the grassroots, from the dark ages, even up until now. We've seen the trends of how digital health has evolved from time past even till now. All right, so right about now, we'll be moving on to the next session of this conference. It is a privilege tonight in our midst this evening and right here in this conference. We have the CEO and the founder of Mobi Health right here in our midst, and she is going to be sharing with us how to position yourself as an healthcare professional to transit into the world of health tech, into digital health, and how you can maximize and take advantage of the benefits that technology is bringing into healthcare. Join me, jam your hands together in the chat box, and welcome Dr. Funmi Adewara, the CEO and the founder of Mobi Health International.
Thank you so much for cutting that short, but thank you so much for the wonderful citation. I really don't like it when people have to read all that out about me, because then it sets a very high bar for my delivery. But ladies and gentlemen, I'm very honored to be in your midst today. I want to thank the organizers of this event for inviting me over to speak about this very all-important topic at this very point in time. I want to recognize the presence of Dr. Akongbe, through whom you were able to reach me and send the information regarding this conference. And I did come in towards the end of his presentation, but I could already pick up from so many things that he has said that I think some of the things I'll be touching on, he has already covered as a professional, as an expert in the field. So thank you very much, ladies and gentlemen. It's a great privilege to be in your midst today. As I've been introduced, I'm the CEO and the founder of Mobi Health International, and I'm one of you. So please just relax, okay? Like many of you, I started off my career as a doctor in the healthcare industry. But today I've been asked to talk about curating a career pathway in digital health. I must say that this is a topic that is beyond 30 minutes, which I've been given to discuss. I mean, even a whole day is not enough to cover that kind of a topic. So I'll try as much as possible to just speak on this outline and probably take questions afterwards. I'll give you a brief background and definition of some of the terminologies that are being used in this space. I'll also shed a bit of light on application of in detail, and then just give you an overview of the digital health trends and the opportunities that abound in Africa and also globally. Who are the stakeholders in this value chain that we want to talk about, and who exactly is a digital health expert? What are the skill sets that you need to be a digital health expert, if there is one? And then the opportunities and challenges, some of our learning points since we launched out in Nigeria and some other parts in the UK, and as we're expanding into other African countries, and then just some conclusions and question and answers. By definition, health technology is defined by the World Health Organization as an application of organized knowledge and skills in the form of devices, medicines, vaccines, procedures, and systems, which are developed to solve a health problem and improve the quality of lives. That's as simple as that. Health technology is the intersection between health and technology. Whereas digital health refers to the use of information technology in medicine and other health professions to manage illnesses, health risk, and to promote wellness. So you see there's a bit of overlap there. Digital health, health technology, so people use it interchangeably. But digital health itself is a discipline that includes all digital care programs and society to enhance the efficiency of our healthcare delivery and to make healthcare more personalized and precise so that we can deliver better quality of care to patients. According to NICE, that's the national what do you call it? National, I forgot now, sorry, it just skipped my mind, on clinical excellence. It means that any application, programs, and software used in health and care system, it may be a standalone or combined with other products such as medical devices or diagnostics. So any form of applications, programs, software, or hardware that you use either as a standalone product or in combination with other products and services is what digital health is. So those who are applying digital health solutions are expected to have what we call digital competencies. And this applies to all healthcare practitioners across the value chain, whether you're from admin staff to or medical record officer, a nurse, a doctor, an accountant, whatever you do that contributes to the patient's care, you are in that space and you are expected to have competencies that relate to digital health. So what I'm trying to say is that the terminology itself about the way you were looking at it, at digital health expert, the fact that technology is revolutionizing healthcare doesn't mean that you have to abandon your career pathway and then start to learn new, then move into a new terrain, which is called digital health, that you have to become a digital health expert. No, it means that wherever you are right now, whatever you're doing, you need to upskill in a way that can make you relevant in this 21st century digital health revolution. So if you're a nurse, you have to upskill in terms of how you manage the patient, how you enter their data, the vital signs, how you record their, you put in their medical record using the electronic medical record system. If you're a doctor, before you probably see a patient in the hospital, they come in, you get the medical record officer brings their folder to you, then you document and do the rest of it. Now that is changing. So you as a healthcare professional in the value chain, wherever you are, whatever processes and procedures that you are currently doing, how do you apply technology to make it more efficient? That's what I think we need to focus on. I think that should give you some kind of comfort that it's not like you're being told to abandon your career pathway and then start to look for a new career as a digital health expert. I hope that that's clear. So why are we talking digital health transformation? There are 7 reasons here that have been highlighted, more than that. But this is because healthcare systems worldwide are confronted with major systemic challenges stemming from economic, organizational, logistical challenges. And this is because of the way the healthcare system historically has been built into fragmented silos, resulting in inefficiencies and wastage, as well as poor patient management. And the COVID-19 pandemic has only accelerated the digitalization of a point of no return. During the COVID-19 pandemic, people were unable to go to hospitals. The doors were shut, hospitals were turning people down, and people with chronic diseases could not access their medicines. They couldn't access a doctor. They couldn't go to. We never knew that there would be a time in the world when people will be turned back and will not be able to access care. But it happened 2020, 2021. So one of the silver lining of the pandemic is that it has now accelerated the digitalization of healthcare as well. And it has brought digital health to the forefront of global health discussion. Technology has the potential to transform unsustainable healthcare models into sustainable ones, equalizing the relationship between a medical professional and patient, providing cheaper solutions faster, indirect cost savings. If you had to go to the hospital before, you had to take your car, go to the hospital, that contributes to pollution, environmental pollution. If you have a child at home, you probably need somebody to babysit the other child so that you can take the other one to hospital. If you are going to work, you have to abandon your work and then go to hospital. But now with digital technology, you have the ability to consult with a doctor instantly and get the help that you need. And most of us have been practicing this before. It's not just starting now, but what is different is that digital revolution is making it possible for us to provide this solution at a scale and in a more secure and organized way. So the digital health ecosystem comprises of e-health governance, mobile health, electronic health record, digital health literacy, and so many other things, which I believe Dr. Akongbe has already shed light on. So I'm not going to dwell on it. I know we all like money, right? We all like to talk about money because, I mean, it's the wheel of the gospel. So one way to look at this is the global trend in digital health. Digital health is one sector that has been growing astronomically. Before COVID-19, it was on an upward trend. The CAGR, compound annual growth rate of telemedicine companies were in the range of 20 to 25%. And then boom, COVID came. And we saw a massive adoption of telemedicine and other digital health tools. So the market is estimated to reach over $500 billion by 2025. That's over $504 billion. And you will see different segments from device to telehealth, EMR, and different component wearables and the rest of it. I'm not going to dwell on that, but this is to tell you that the market is booming and it is the right time for everyone to get on board. This slide also just shows you the trend in terms of mobile application, the Internet of Things, where they stand in terms of their value in the market. So what are the digital health trends that you should be on the lookout for? Telemedicine and telehealth. Telehealth and telemedicine are used loosely interchangeably, but you could say it means the provision of remote care to patients, whereby you're not in the same room as a healthcare provider with a patient, but you're able to provide clinical care to them. It may come in form of telephone call, chat, or video calls. Telemedicine simply means using modern day technology to provide clinical care from a distance. It can help with cost savings. It's convenient. You have access 24/7. It democratizes access to healthcare so that the patient is not restricted to just the doctors that they know or that is within their own local vicinity. So if they need further expert input, then with telemedicine, that is possible. You have the Internet of Things, where the Internet of Things is now meeting up with technology, with medicine, and that is called Internet of Medical Things.
Wow, wow, awesome, awesome, awesome. Dr. Fumi, I'm short of words. Thank you so much, Ma, for this amazing presentation. It's more than a presentation, Ma. It's more than a presentation. You've sincerely and with passion, you've opened our eyes and the participants' eyes to a lot of opportunities embedded in digital health, and how they can, better position, how we can better position ourselves to maximize, the opportunities and the benefits of digital health, and also using mobile health as a case study to describe, the things you've been saying since. It really gave a much more deeper insight into what digital health solutions and digital health look like. Thank you so much once again, all, for participating. So you're totally disconnected from the physical environment and you are immersed in a digital. An example of this is, for instance, take for instance, a medical student who is trying to understand the particular structure of a certain organ. Let's take the heart, for instance. Now, there's a digital image of the heart. Through virtual reality, the medical student can be disconnected from the physical environment and then is able to interact with a digital image as if it is real life. The medical student is able to interact with this digital image as if it is real life through virtual reality. And as such, this particular trend has brought an increase to, has brought a transformation and is also transforming the way medical education is being offered. Also, it helps with surgical training and planning, which allows both patients and surgeons to get more comfortable. It can be used to manage physical and psychological conditions like stress, anxiety, dementia, and chronic pain. Currently, there are some virtual reality technology that are currently being used in managing some mental health conditions such as Alzheimer's disease and some other dementia as well, and some other kind of mental health condition. Also, all right, so I will move on. Also, it is also used in robotic surgeries, which means fewer risk of complications and a faster procedure. So if you want to read more and learn more about virtual reality, there will be some links sent to us later after this event where we can get more information on these digital health trends. So as to conserve time, I would like to move on. So the next trend is the Internet of Things, the IoT. In the medical field, we call it Internet of Medical Things. Now, what does Internet of Things mean? Internet of Things basically means it could be seen as some devices that could be worn on your body, gather your healthcare data, and transmit it through the website to your healthcare providers. Internet of Things involves the use of some wearable devices such as trackers, smartwatches, smart bracelets, smart chains, or any smart wearable devices that is capable of obtaining some of your medical data, obtaining some of your physiological parameters, and transmitting it directly to an healthcare provider, maybe your doctor or your nurse who is in charge of your healthcare, and that made him have access to these data without seeing you physically. And an example of this is there's a smartwatch that can read your read your heart rate, that can also monitor your blood pressure, that can monitor your ECG. And after these data have been generated, it is transmitted through the website to your healthcare provider, who sees the result of this and can from remotely monitor your healthcare, monitor your health status, monitor the progress of a recovery or some other things, and make do with anything he wants to do with the data. As healthcare professionals, what is the implication of this particular technology to us? The implication of this is that we as healthcare professionals have to be conversant.
Wow. Can we please give him a round of applause in the comment section? Thank you so much, Nurse Adewumi Tobiloba. I mean, it was a very wonderful presentation, taking us through the top digital health trend in this decade. Thank you very much for that beautiful presentation. We'll be moving to the next section, which is the panel discussion. Yes, I mean, this is the real deal. This is one of the main reasons why we are here, to explore opportunities, challenges. That's why we brought professionals to our meet to actually take us through this discussion, so that we can learn, we can apply, and we can also explore these opportunities. So the topic